Fox Medical. Sponsored locally by Regents Blue Shield.
Well, you know what? If you've been struggling with a summer cold, it could be COVID. Since the pandemic public health emergency ended 3 months ago, hospitalizations are once again on the rise. And the Fox Medical team's Beth Galvin joining us live this morning with what to do if you get sick now. Beth, good morning to you.
And good morning to you, Bill.
So Beth, how can we tell the difference between whether it's a cold or maybe COVID?
So it's really hard because the symptoms can be very similar, and most experts will tell you really the only way to do it is to maybe do a rapid test. So one of those at-home tests that you can buy for about $10 or $15 at the drugstore. They take about 15 minutes for you to get an answer. They tend to be pretty reliable if you get a positive result. So if you do get a positive result, that typically will mean that it is COVID, not a cold.
So if we do test positive, what should we do then?
The CDC is recommending that you stay home from school, stay home from work, and isolate for 5 days if you get a positive test result on that at-home test. And that is just so that you're not infecting anybody else around you. If you live with other people, it might make sense really to sort of, try to stay sort of sequestered in your bedroom or your area of the house, and to try to wear a mask when you're going to be around other people who are in your house, just to try to prevent the spread. I have a friend who, made it, 3 years through the pandemic without any COVID in her house, and then one person got sick, and then pretty soon all, 5 of them were sick. So it is still happening, even though we're officially out of this, public period of an official pandemic.
So the PCR tests are a bit tougher to find these days, but if I do test positive on the rapid test, should I get more accurate test results?
That's a good question. It will give you a more accurate results. And the reason why you might want to consider seeking out a PCR test is that gives you a record that you had infection. So if down the road, God forbid, that you develop long COVID symptoms, you have, some of the symptoms that we're seeing a fraction of people experiencing even after they're finished with the infection, still having fatigue and issues like that, you might need to prove that you were positive at some point, either to your insurance company to get it to cover follow-up treatment, or to your employer if you've missed time. So it does make sense, just to have it on record, and to get it on record, the at-home antigen test doesn't really count as an official record. You would need a PCR positive test for that, Bill.
Medical correspondent Beth Galvin, thanks for your time. We appreciate it.